According to a recent survey from U.S. News and Generation Lab, 70% of students say they've struggled with mental health since starting college. But the data also shows that most have never actually looked for help. Psychotherapist Dr. Robi Ludwig joins us now. Dr. Ludwig, I find this interesting, and I want to actually pick up right there. Why is it that a lot of students aren't seeking help?
Well, I think in some cases it's due to stigma. So if there's stigma surrounding mental health and mental health treatment, they will be less likely to seek it. And in other cases, it's education. They may not know that it's available to them, and that's why education is so important for both high schools and colleges to let kids know, hey, if you're having a problem, there is support for you, there is help for you. And sometimes certain depression and anxieties can show themselves during 18 or 19 years old, which is right around the time when kids go to college.
So maybe even present for the first time.
Yes.
What are kind of the most common conditions or challenges we're seeing kids today face when they go to college?
Well, I think anxiety is at an all-time high, and depression, and then there's adjustment challenges that are within the norm. But a lot of these kids are young, they're leaving the safety of their own home, and they may have an image of college that it's just an easy transition, which is not the case. It takes time. And I think if kids know that it takes time, then they'll be easier on themselves and pressure themselves less.
When you mention how anxiety is at an all-time high, I wonder, is it that, kids today are actually facing more circumstances that are anxiety-inducing, or do we just now have the language to describe these things now in a way that we didn't, 30 years ago?
It's such a good question. And I don't know that we know the exact answer, but I think that there's more awareness of mental health, and kids understand when they're feeling and know that they can say it to adults now. And I also think technology is disconnecting us so that we're having a long relationship with our phone and we're not connecting to others face to face, which reduces anxiety if you're connecting with the right people.
A great point. You mentioned resources, the resources that students do have. What are those resources for students, but also what are the resources for parents?
Yeah, so for students, they usually have a mental health facility on campus where they can start you off for short-term treatment. So something within 6 to 12 sessions. And then if somebody needs more, then they'll refer them out for longer-term treatment. There's also peer support and hotlines as well that can be available for students. For parents, we have to be the adult in the room, sadly, even though we have all these intense emotions. And we need to be aware that we need to manage our own feelings. So whether that's going to your own therapy or finding a support group of parents who are also like-minded, it might feel comforting. And just to know your job is to support your child's growth and independence, and you can feel whatever you like as long as you show up for your child in a way that's healthy.
And ultimately not pass that anxiety down to your kids, right? I mean, they're already dealing with so much. And I think it is important to note that a lot of those resources you mentioned on campus, typically, oftentimes, they are covered by insurance if the student is enrolled with a student insurance program. Dr. Robi Ludwig, thank you so much for your help and your expertise. We always love when you come to join us in the studio.
Important topic.
That's right. Psychotherapist Dr. Robi Ludwig. Stay right here. You are watching NBC News Daily.